malfunction. Most people don't know that, and it's also a silent killer. I will briefly talk about that. So, what is high blood pressure? High blood pressure is the rate at which the heart function, the rate at which the heart accepts oxygenated blood and deoxygenated blood. Our heart is made up of 4 chambers. The two accept oxygenated blood, and the other 2 accept deoxygenated blood. I will not be going much into medical terms, but I just want us to know that in our body we have vessels and arteries. Those are the channels through which the blood go into the heart. High blood pressure is a disease that affects mainly the heart. It makes the heart malfunction. Always to check the blood pressure. At the upper arm, this is our upper arm. Tí a fẹ́ mọ̀ bí ó ṣe ń ṣiṣẹ́ sí, ó wà ní apá òsì àyà wa. Then, our ìfúnkìrìtà bẹ́ẹ̀ ni check ìfúnpá yẹn, which is the BP apparatus. Ó gbọ́dọ̀ wà ní apá òkè ní ọwọ́ òsì wa. So, ọwọ́ òsì sísà mi òun ni eléyìí. Ọwọ́ òsì wọn lélẹ̀ ní apá òkè báyìí, ibẹ̀ ni a máa ti wò. Then there is something here ní ibi báyìí wa tí à ń pè ní arteries. That is the place for what I fẹ́ check the frequency of the pulse or the frequency of the blood pressure to the heart. So ẹni tó máa check ẹ̀ fún wa yẹn, a gbọ́dọ̀ rí wípé ó gbé ìfúnpá yẹn wá sí apá òsì báyìí. Òògùn kó wà níbẹ̀ báyìí. Eléyìí òun ni wọ́n máa lò tí wọ́n máa fún apá wa bí báyìí. Okùn yìí ni mo sọ wípé nígbà tí a bá fi sínú kíní bíbí yìí, ó gbọ́dọ̀ wà ní àárín ọwọ́ wa bí báyìí. Arteries ni ó gbọ́dọ̀ wà níbẹ̀ níbi tí a bá fọwọ́ kan báyìí bẹ́ẹ̀ láti máa gbọ́ pì. Ṣó yẹ yín mà? So tó bá ti wà níbẹ̀ yẹn ká ti fún tó ti fún apá yẹn tó ti wà níbẹ̀ nígbà yẹn láyé ṣe máa wá tan BP apparatus. Okay, what I'm trying to say now is that this very place, there is a pulse here, a place that we can check our pulse here. So when you place the BP apparatus, this very thing must be at the center of where that pulse is reading. You can check it yourself. You will see it will be pim. That is your pulse. So if you put it, you put it exactly at this place, and you make sure that this pattern that you should concentrate on. Even when you have BP, the down parts, if you are using your medicine as you ought to be, it's a daily pill anyway. You should notice very well the down parts. And BP reading depends on age, the size, your sex, whether female or male, and how active you are being in the day. But on a note, the down one should not be more than 85, 86, 87. Once it's going to 90, something is wrong. Even if the upper one is 100 and the diastolic is 90, something is wrong. That is a signal telling you that you are about to develop BP, or probably you did not sleep overnight, or you have overstressed yourself that you need to rest. Can you see what I'm saying? Do you know why I allow her to leave the clothes like this? Is because the clothes itself is not that thick. And if I say she should just swap it off, it's going to put more pressure on the hand, whereby increasing the reading. I will try somebody that's have a short nose. Now this is the art here. Make sure that your health provider asks you, or you yourself raise that very arm on the ground. Whatever chair you can, please tell them that you need the one that your foot will be on the floor. Then you must have emptied your bladder. Make sure that you don't have any urine in your bladder. Empty your bladder before you start doing your BP. Now, I press it. If I press it now, it will start reading. He's going to give us 3 results reading for them, because God is so funny the way He creates us, that as we are growing older, our body system will become like children old. So their birth rate will be very similar to a year-old baby. It's faster. When you give birth to a baby, just touch the heart. It will just be the birth rate will be fast. Then as the baby is growing older, it will be reducing. So also our editing. And you now went to go and check and say, my BP is high, I already had BP. No. You must have checked and checked and checked. If possible, you must have gone to the hospital to check, to confirm from the doctor. They will ask you some questions, then they will now ascertain whether you have it or not. Please note that when we just discover that we have BP, we start using BP drugs. No, it's not done that way. It's not done that way. Even if your BP is high at a particular time, try and check. What did I do? How was my activities in the day? What did I eat over the night? We'll get to that place anyway. But I'm just trying to tell you that it's not the first time, the very first time that you check your BP, that you just accept it immediately like, oh, I have BP. Then let us check all the time. Now, I want to talk on the causes of high blood pressure. We have a lot of things that can cause it, but the first one I want to address is genetic factor. Genetic factor is the things that runs in your family. Some people will be wondering, I don't have any stress. My husband is not giving me stress. My children are not giving me any stress. I don't have any issues. I'm not thinking of anything. I don't eat more than enough salt. Then why am I having high blood pressure? I want to inform us today that genetic factor can cause it. You can inherit it from either your mother or your father. There's one thing that I've come to realize. I don't know, it has not been scientifically proved anyway, or medically proved. But from my own clinical experience, when I check a patient and I see that the patient has BP, I will ask the patient, who do you look like in your family? And funny enough, if the person says it's my mother, ask the person, does your mother have BP? You say yes. So BP, one of the fundamental reasons why we have BP is genetic factors. Another reason is high cholesterol. Cholesterol, ọ̀rá inú ẹ̀jẹ̀, òun là ń pè ní cholesterol. Ọ̀rá tó wà nínú ẹ̀jẹ̀, àwọn èèyàn máa ń rò bí ẹni tó bá ṣọ́ra, irú ẹ̀mí báyìí, wọ́n máa rò pé ẹni tó bá ṣọ́ra ló máa ń ní ọ̀rá inú ẹ̀jẹ̀. No, anybody ló lè ní ọ̀rá inú ẹ̀jẹ̀. Ẹni tó gbẹ ó lè ní, kẹ́ni tó lè ṣọ́ra bá tù à kó máa yàn. It's also a genetic factor also. So we need to check anybody that have BP, that diagnosis of BP, please go and check your cholesterol level. This is what is called cholesterol. Ọ̀rá tó wà nínú ẹ̀jẹ̀, and we use soakaway pipe to do the illustration. Now, if you go to the toilet and you poo, you flush. If your pipe is free, you know it will just go. You will not even feel the effect, the odor of that poo, no matter how smelling it is. But if the pipe is blocked, what will happen? It will be smelling. The whole house, in fact, in as much as the thing is not flushing, going to the soakaway, the whole house will be in mess. That is how it is. If the blood can, if the